House Democrats will vote today on their proposed multi-billion-dollar aid package in response to the coronavirus outbreak. The plan includes 3 weeks of paid sick leave, coronavirus testing, and food aid and unemployment insurance. But the challenge will be to get the White House and Senate Republicans on board. And as Washington works on plans to confront the coronavirus, one group facing unique challenges around this outbreak is America's poor. There are growing concerns about how corona could impact soup kitchens, food banks, homeless shelters, and how about America's poorest kids? On any given night, more than 560,000 people experience homelessness in this country, nearly 80,000 of them right here in New York City. Overall, more than 38 million people in the United States are living in poverty, and I promise you, they're not ready for corona. For many low-income workers, more than 40% of them have no contractual right to get paid sick leave. Joining us now, former Congresswoman Donna Edwards. She's a Washington Post contributing columnist. My dear friend Wes Moore, the CEO of Robin Hood, New York's largest charity-fighting organization that saves lives every day. And my friend Bret Stephens back with me from the New York Times. Wes, what is the most urgent challenge facing the poor?
The most urgent challenge facing the poor is the fact that we're watching an exposure of something that the poor in our country have been dealing with for a very long time. We're now watching the implications of it show itself. We have a situation where in this country right now, just take New York City alone right now, half of the population has been in poverty for at least a year over the past 5 years. Half of all New Yorkers, and who are one singular shock away. Well, guess what? COVID-19 has just become a singular shock.
So when you're any one of those people, and you're watching the instructions, social distance, be 6 feet away, don't go to work today. Yeah. A homeless shelter, your cot is 6 inches away. If you're at a food bank, you are you're right up next to the next person. What do you do? How do they address this?
The challenge is that also you realize even the level of privilege that we have. So, for example, organizationally at Robin Hood, we can come up with a policy of saying, well, you know what, everyone can work remotely, or everyone can do X, Y, and Z, and we can respond that way. The majority of the organizations that we support, they don't have that level of flexibility. And so you have something where you can have basic frameworks that you can ask people to try to follow. You can ask people to say, social distance. You can talk about things like, well, how do you have regular hand washing stations, or every hour on the hour you do X, Y, and Z. But for the vast majority of people who are living in poverty, that's not an option. The vast majority of people who, by the way, are the working poor, who then have to think about, should I then dock hours because my child now has their school canceled? Do I need to necessarily take off from work because I have a sibling or a cousin or a parent who is now sick? These are people who are now having to make decisions that are not just going to change their current reality, but that have the potential of changing their entire family's trajectory. And they have to do it in real time. That's the danger of what we're talking about right now.
What happens to organizations like food banks who are reliant on volunteerism? They're reliant oftentimes on corporate volunteers every night of the week serving people dinner. And we have been told, stop all our non-essential activity. Most of us view volunteering as non-essential. What happens to those organizations dependent on us?
Volunteering is essential also when we have policies that are not in place to be able to take up the basic supports. We're having a debate right now about things like paid sick leave, and I'm actually heartened by the fact that we're now seeing policies that are proposing things like paid sick leave. The question that it also proposes to me are things like, why has that not been a policy that we've had in place before? Last night, Stephanie, I went to Chinatown. And I went to Chinatown to go visit one of our partners, CBC down in New York, which is they're one of the largest organizations, community organizations that focuses on everything from after-school programs to housing programs, supports for children, supports for seniors. I rode the 6 train to try to get down there at 5:30 in the evening, and the 6 train was basically empty. We went down to Chinatown. The streets were basically empty. We went to one of the more popular restaurants, and because I wanted to spend time and hear from them. What are you seeing? What are you hearing? How can we be most helpful? This is one of the most popular restaurants in Chinatown.
What'd you learn?
It was empty. We were one of 2 tables that were being used. The fear around this, in many cases, unfounded fear, the xenophobia that's taking place is real. And so when we're talking about the ability for people to volunteer and support, it's not just a be nice and do good thing. This is life-saving for a lot of people. And we're watching organizations that are taking a significant brunt right now, whose sole constitutional responsibility is serving people. And they're getting hit the hardest.
Congresswoman, how do lawmakers address this?
Well, I mean, this is why the package that the House has put together is so important, because it's actually focused on people, focused on the most vulnerable in our communities, people who are low-wage workers who work hourly work, the wait staff at a restaurant who may have hours reduced because the tables are empty. And those are folks who most need our help. I'm thinking about the hundreds of thousands of children who, if you have a school closure, the only way that they get breakfast, lunch, and sometimes dinner is through the school nutrition programs. And so reinforcing that kind of basic support system, I think, is what the House is trying to deal with immediately, making sure that testing is widely available and affordable for some of our most vulnerable people. In homeless shelters, trying to make certain that they have the tools and resources to be able to keep, sanitary conditions, making sure that people are fed and get their nutrition so that their immune systems are healthy to be able to combat illness and those kind of preventive strategies. But, what this crisis indicates is the level of food insecurity and housing insecurity that are faced by ordinary Americans, some of whom work every single day and multiple jobs a day, who now are the most vulnerable when it comes to this coronavirus pandemic.
Bret, what's your take?
I mean, really, it's a question to Wes and to the Congresswoman, which is, how do you push back a little bit against a bit of the CYA that we're seeing from some institutions, universities who are canceling classes, for example, when those universities are actually places where especially the poor students can get food, can get health care, they're comparatively healthier populations, housing, schools that are closing down when those schools are essential for their parents so they can get to their jobs, they can get their kids fed. How do you push back a little bit and say, hang on a second, this isn't the vulnerable population. These are institutions providing essential services. Let them do their work.
And it's actually a really important question, because I think also the thing we've now seen is how different universities are dealing with this, where you have universities that have large endowments and the private institutions who can close down, who can go remote for the rest of the semester. And you're watching other institutions, you're watching many of our public institutions, community colleges that cannot.
Going remote is for the rich.
Yeah. That's it, and that's the point. We're watching how this societal differentiation is now taking place right in front of our very eyes.
Grab a laptop on your way out and dial in tomorrow. That's not an option for millions of people.
School systems that say, we hear you city, we hear you state, we hear you federal government about the idea of potentially shutting down. The challenge is, what happens to those schools that don't have things like remote access? What about those communities that don't have basic Wi-Fi? How then are we not continuing to enlarge the depth of disparity that we have among students who are our most vulnerable? So you're absolutely right. I think the thing that we need to ask our institutions to do right now, specifically our private institutions, is be creative, be thoughtful. You have land, you have infrastructure, you have endowments, you have capital.
Don't just close the door.
Don't just close the door. Be creative, be thoughtful, engage the community, because there are things that you can do that you might not have initially thought about that could make a marked difference in helping us to actually work through this crisis right now.
Right, and you can go down to Chinatown and have a meal as well.
That's exactly right.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.